response to the COVID-19 pandemic. We're joined now by Congressman Jodey Arrington, who represents the 19th district in the Texas handle. Thanks so much for joining us.
Great to be with you, Lindsay.
So you heard in Jonathan Karl's report right there. Any concern from you about Dr. Fauci being sidelined by the White House as cases surge in much of the South, including your state of Texas? In your opinion, is it pertinent for the president to still be briefed by the most senior infectious disease doctor in the country?
Yeah, I don't think I would necessarily sideline Fauci, but I wouldn't give him the megaphone that he's had. He's a singularly focused government infectious disease doctor whose metric is people don't get sick and don't die. There are lots of risks that people have to manage every day, and leaders have to manage. The fact that we could have far greater implications, adverse implications, for being in a shutdown mode and not opening our economy, getting folks back to making a living. There are individual liberties, there are economic implications and long-term public health. So Fauci's one voice, but we need a whole lot more than just Fauci in terms of people in the president's ear and in any ear of leaders that are making these multitude of decisions.
Curious just to get your response on the president basically talking about the CDC and doctors today, saying everybody's lying.
Yeah, I don't look. Again, I think you've got government bureaucracies like the CDC. They have a role, but I would not give them the pen to write the protocols for every state. I think the president did the right thing by deferring to states and local communities. I think he did the right thing to empower the free market to innovate, to accelerate developments of testing, and to create more capacity around PPE. So I think they have a role, but I would not make them the centerpiece. Again, people closest to the problems, closest to their community, and those folks that understand the conditions on the ground are the best people to handle this and manage it responsibly, and they're the most responsive to their citizens, and citizens ought to have a say in a democracy like ours in our protocols and decisions made, even in situations like this.
So let's go on the ground to the citizens, your state of Texas, seeing cases on the rise, but so far your district is not a hotspot. Are there lessons that you'd say that you would draw from places with huge spikes, and are you telling your constituents to wear masks and also to social distance?
I think the conditions on the ground should dictate how to respond. I think every business, for example, is incentivized to take all the necessary precautions. If there's a rash of COVID outbreaks at various businesses, that's going to hurt them long term. So again, everybody, I think, has the right incentives. If government will give them information, empower local leaders to manage, including healthcare providers, they can manage the capacity. There's 2,000 beds in Houston, Texas right now. I know that they're seeing a bit of a spike, but again, I think Houston's capacity is different than Lubbock, Texas, and Abilene, Texas, places I represent. I think, again, deferring to the local leaders to make those decisions and giving them the best information is the best way to handle this, so that, again, we manage not only the near-term public health implications, but the long-term economic and public health implications for our citizens.
So, but just to be clear, are you telling your constituents that they should wear masks?
I'm not telling my citizens to wear masks unless masks are the right thing to do, the most responsible thing to do. Again, every situation dictates different protocols. In some cases, social distancing. In other cases, it's mask if it's more densely populated. But I don't need to make that decision for them. They're plenty smart and responsible if we give them the information. And with what's happening on the ground, which is different in different communities, they ought to be able to manage that responsibly. And so far, I think Texas has done that. If you look at Texas, Arizona, and Florida, and their death rate, it is half the city of New York. half, and they've got 7 times the population. So I think we can expect you're going to see an uptick in numbers of cases for states that are reopening on the heels of July 4th celebrations all around the country. And then if you got a situation like Houston, where the mayor has led tens of thousands of people in protests and marches, I think all of those are contributing factors. I expect that it will be managed back down to a more reasonable level.
So many of your Republican colleagues, including Texas Governor Abbott, have come around to advocating for Americans to wear masks in public when they can't socially distance. Would you say that the president should be more forceful in supporting that message?
I think the president, Lindsay, has taken the right approach, and that's saying, hey, states, governors, and local leaders, you are more responsive to your people. You are more sensitive to the conditions on the ground. And we all know that there are some basics in this prevention of the spread, like good hygiene, like social distancing, and in some cases, masks. And I think local leaders, I think citizens in every community, business owners are all incentivized to do the right thing and the responsible thing, not just for them, but for their entire community. I haven't seen that play out in a way that's surprising or unmanageable at this point.
Congressman, just for academic debate here, I'm just curious. I mean, the CDC has said definitively masks make people safer. Masks help eliminate the spread. Why are some people, especially in politics, so reluctant to say, hey, guys, let's be safe. Let's wear masks?
Well, we have had government officials and public health experts, including the Surgeon General, say one day that masks work and other days that masks aren't the best way to manage it. I'm suggesting that we should let local leaders and our citizens make those decisions unless there is systemic inundation of the health system. I think if the state were completely inundated and overwhelmed, that would be a different scenario. And if your local community is inundated and overwhelmed, then I think you can ratchet up restrictions and you can engage, more definitively with various protocols. But unless and until you have that kind of systemic adverse impact, I think you defer to the citizens, and I think because most folks would say this isn't just about the near-term public health impact. There are intermediate and long-term economic impacts, and we should always, in the mix of the decisions, consider people's personal liberties. I think you can do all the above and manage this responsibly at the state and local level, and I think so far Texas has done a pretty good job of that.
Okay, and want to stay on that economic point that you were just making. You made a comment that businesses should be compensated by the government for shutdown losses. What specific measures do you have in mind? And what's your bigger concern, exploding deficits or state and local governments and businesses going under because of this crisis?
Well, I have a tremendous concern about the fact that we have the highest debt load per GDP than we've ever had as a nation. And if we ever have a sovereign debt crisis, we won't be able to borrow money and print money fast enough to bail out of that crisis. I think we've got to keep our eyes on that, and we've got to manage it responsibly. And so, in terms of shutting down businesses, not just saying let's wear masks, let's do the various things that I think, again, can be extreme if there's not a systemic problem or they're going to overwhelm and inundate the health system. But I do think if you're going to say, hey, these businesses are going to shut down, that's a taking. You've got to compensate these folks. This is their livelihood. This is how they care for their families. And I think that there should be shared risk and responsibility at the local and state level. You cannot have a situation where the federal government's going to come in and bail everyone out. Everybody's got to manage all of these objectives. They all have to manage the risks, and it can't be put on one entity, especially the federal government, which is notorious for spending trillions of dollars and not having much concern about the debt and the now almost $4 trillion in deficit spending in 1 year. So you've got to have a shared risk and responsibility model if you're going to have people make the right decisions and not create moral hazard where we're bailing people out left and right. That's the wrong approach.
Congressman Arrington of West Texas, thank you so much for coming on the show. We really appreciate your time.
Great to be with you, Lindsay. Thanks.
And next to the